one thing I'm proud of, we stand on the shoulders of so many leaders and so many wonderful leaders that have really built that for 75 years. And they've done such a good job of not only growing what our region has access to with those specialty services, providing rural health care is a huge thing to be doing these days. We should be proud of that.
Hey, this is Shay.
And this is Carrie.
Welcome to the Pocket Change Podcast,
where you'll learn better ways to spend, save, and invest and take control of your financial journey. So today we have the unique opportunity to highlight one of the most well-known organizations in our community.
Yeah, they've been around even longer than Leaders, more than 65 years. So
I mean, 75 years in our community. So I'm excited about this.
They're all throughout West Tennessee, helping support the community, our health, and our well-being. And so we're excited to welcome them today.
Yep. We're excited to welcome our guest, Tina Prescott, President and CEO of West Tennessee Healthcare. Welcome to Pocket Change, Tina.
Thank you so much.
Thank you. We're so excited to have you with us today. So can you tell us a little bit about yourself and your journey with West Tennessee Healthcare?
So with West Tennessee Healthcare, I started when it was Jackson Madison County General Hospital in 1996 as a surgical ICU nurse. Had a passion for the surgical patient, and we eventually were involved in the trauma program as well. So I got to do a lot of fun, adrenaline-packed care for patients, and just love taking care of those patients and their families and helping them through that journey of an ICU patient. Got into the management side of things pretty early on, a couple years in, and got to be the manager and director of that unit eventually, and finished my master's in business at Union, and just looked for an opportunity to use that MBA within the healthcare system, and so was given the opportunity to serve as an administrator in Camden, as we had taken on that hospital as part of West Tennessee Healthcare at that time. Just a huge time of growth for the health system then. And so I really can't believe they gave me a chance to be an administrator of a hospital, but it was probably one of the ways that I grew the most as a leader, because I had the medical staff, I had that advisory board there, and loved that hospital. It was definitely a family, and that's really one of the things that's really a hallmark of West Tennessee Healthcare. We feel like we're a work family. Even though there's over 8,000 employees now, we try to focus on the fact that it's a work family. I spend more time with my work family most days than I do my own children. So it's been a great opportunity. Was asked to come back to Jackson as a VP of Hospital Services in 2007 and served as a CNO there, and then Chief Operating Officer for the system, and then most recently as the President and CEO.
That's wonderful.
So, what drew you to the healthcare profession?
So I always had a real love for math and science. I think I really had some wonderful teachers. Grew up in Middleton, Tennessee, and that high school level, had some great chemistry, biology, math, all kinds of math, wonderful interactions there and learning. And so just kind of had that affinity for the sciences and thought about medicine, and quite honestly, just really didn't see the track there for how I could get to that goal, and thought, what could I do in medicine? And that's where nursing just came to me, and was accepted at Union and got to attend Union University, and they have a wonderful nursing program, and was able to graduate from there with my bachelor's in nursing. And so just kind of fell in love with nursing really at Union, and had an affinity for taking care of people, I think is the main thing. When you have that heart for caring for others in those times of needs, I think you find your path somehow in that world of healthcare.
That's wonderful. I do think it is a passion that is instilled in you, and it just takes you places. So I know that culture is very important in your organization. So can you tell us a little bit about the culture that you're trying to build?
Yeah. So I've worked there for almost 29 years. And from the moment I started, the culture has been about love and respect for people, whether that person is the patient that you're caring for in front of you, or that family, or that visitor, or your teammate, the person that you're working with. It's love and respect for people. And I think that when we get that right, if we can stay true to love and respect for people, the rest of it kind of falls in place. And so we try to focus on that. Healthcare is definitely difficult. It was difficult in 1996, but I think post-pandemic, it's even more difficult for our teams to really hang in there and do their best every day. I don't lose sight of the fact that people come into that world of healthcare, and there's stuff they have going on in their own personal lives, and they set it aside for that for that period of time to really delve into other people and give to other people. And so I feel like we need to take care of each other so that we can take care of other of the patients in front of us. And that's been part of the culture that's been there at West Tennessee Healthcare for, I know, almost 29 years. And I know it's before then as well.
That's wonderful. So 2025 is a big year for West Tennessee Healthcare, turning 75. So big celebration of 75 years.
Yes.
So can you tell us a little bit about the growth?
Yeah. So like I mentioned, it was, it started off as the Jackson-Madison County General Hospital. And so we have since grown into just recently brought on our 8th hospital in Henry County. And we've had tremendous growth there with our outside hospitals. And then we've also had tremendous growth in the clinic world where we have primary care and specialty care clinics across this whole region. So I think that it's one of those things where that biggest hospital, of course, is right here in Jackson, but we reach out across West Tennessee with those hospitals and clinics and outpatient services across the region. And one service that we definitely have reached out with post-pandemic is our behavioral health service. And so the provision of mental health services in those communities is really a passion of ours going forward, making sure we're given that same level of service and commitment to the service that we do on the acute care space and the clinic space and outpatient space. And so trying to meet all the needs of the patients that are in the region, almost to 600,000 patients or 600,000 people outside of Shelby County in West Tennessee.
Wow.
So it does take that group of 600,000 plus people. And we feel like when we reach out into those services, when you need that cardiovascular care, that very, very specialized orthopedic, cardiovascular, or neurosurgery, et cetera, all the subspecialties, we can function well as a system if we have those in Jackson, but we're reaching out and across the region to care for those patients in those settings. So,
yeah, people may, call it Jackson General, but it's really a whole system of pathways and sports plus and all the different divisions like you're mentioning. So it's a huge system with a lot of support and services for our whole community. So
definitely
it's definitely grown from just that one flagship hospital to now 8 hospitals.
Yeah, and to celebrate that with 75 years, one thing I'm proud of for that 75 years, we stand on the shoulders of so many leaders and so many wonderful leaders that have really built that for 75 years. And they've done such a good job of not only growing what our region has access to, those specialty services, providing rural health care is a huge thing to be doing these days. It's very hard to do healthcare in those rural settings. And so we should be proud of that we reach out in rural areas. We were able to provide those really specialized services in Jackson for that whole region, and that we do it with our financial sustainability right there at the forefront of what we do. We're proud of that, to be that safety net healthcare system that does it without tax support. And so the community, I think, should be really proud that we're doing that. We stand on the shoulders of people who have been very good with their stewardship and financial sustainability goals, and we continue that.
Yeah, that's huge about being able to sustain that growth. And you mentioned leaders and the great leaders that West Tennessee Healthcare has had. And of course, we were all saddened by the loss of a longtime leader and former president and CEO J.R. Ross of West Tennessee Healthcare. So tell us about his impact and legacy. And if you need a minute, we'll take a minute.
Yeah, that's a... Grief hits you at different times. I apologize. So he is... definitely missed. That's the understatement probably of the century. We miss him. JR, the legacy that he will provide to that healthcare system, it's so hard to just put it into a short sentence. But I do think that when I try to boil that down is, JR was a friend to everyone. He really embodied that verse of a friend loveth at all times. And he was that way with whether it was the patient in front of him or if it was the team that he was leading or any visitor or family or anything like that. He just tried to treat people as friends and love on them, and tried to meet the need of whoever was in front of him and really make a difference in their lives. And that was his life motto, meet the need and make a difference. And so that's incorporated into our culture as well. That's what we do every day. We're not there just to meet the need. We really want to make a difference in our patients, families, and visitors' lives. And I think that will be his legacy as we look back on what he did for that health system. He had a huge focus on people and the person in front of him.
Should be our motto.
Absolutely.
Here at West Tennessee Healthcare, everywhere. Meet the need and make a difference.
I
That's
love
great.
that.
Mm-hmm.
Thanks for sharing that. So I know that you all do so much for families across West Tennessee. And do you have a recent story that you might want to share about that?
Sure. I'm very proud of the access we provide. As we've grown as a system over these 75 years, grown from one hospital into the system of hospitals and this network of clinics and outpatient centers and things like that, what we are growing toward and have made a lot of progress in is where we want people, when they meet us for that first time, hopefully in a primary care clinic where we're helping prevent disease and make sure that people are living healthier. But when they do get sick, that wherever they meet us, we can make sure that they have access to the care they need, whether in their local community, first and foremost. We always try to keep our patients in those local communities if possible. But if they need services, we want to be able to get them to where they need to be. That might be Jackson, might be another one of our sister hospitals in Dyersburg, Paris, et cetera. So one story that just touched my heart recently was one of our patients sharing, it was a heart reunion of sorts, our heart patient reunion. And a patient shared how he had met us first in the Dyersburg emergency department, came in, ended up, he was having a heart attack, so some chest pain, ended up being a heart attack. Those physicians were, and that ER team, he just bragged on them and was so thankful for the care they gave him. And then they got him to Jackson to our heart surgeons. And he then told stories about how wonderful that heart surgeon was, and then his partner and covering for him, and then the cardiovascular ICU team, the nurses on the floor, the housekeeping staff, our environmental services team. He talked about our physical therapist and how, they motivated him to get him up walking and things. And he was so appreciative and so excited to come back and thank everyone for the care provided. And so I think that's what we sometimes lose sight of, is that this huge team of people that pull together every single day, and that it makes such a difference in those patients' lives. So proud of that. And that's just an example of how the system works, right? Wherever you meet us, we can get you to where you need to be within that system for care.
It's so important.
Yeah, and I can attest to the great service. We had a baby just a few months ago, and our second born at Jackson General. So, of course, great care and great nurses and delivery staff. So it was fantastic. But, a lot of our listeners may not know that in 1983, back and even before that, Jackson General had a credit union in the hospital, Jackson General Employees Credit Union, and it actually merged forces with Leaders. We were known at the time as Jackson-Madison County Teachers Credit Union, and I think, our name reflected the fact that we served leaders in the community. It was nurses and healthcare workers. It was teachers and doctors and, educational professionals. And so tell us about what that partnership means, because we've been involved with West Tennessee Healthcare for about 40 years.
You have, yeah. And I remember as a new employee, having those options at our annual enrollment for benefits. We've always seen Leaders right there. That's how employees see our partnership first and foremost at orientation. And we appreciate the partnership with Leaders. I remember as we moved from actually a paper check into a direct deposit situation where we were like, okay, all the checks are going to be direct deposited. That's where I remember hearing the most about the partnership at that time during my employment, to say Leaders Credit Union is the one who's going to make sure that if you need that checking account, they're the ones that are going to step up. And I've seen that grow where we do see you a partner in the financial well-being. We want to take care of our employees too, right?
Sure.
And we feel like that we do try to offer different benefits. And so Leaders is that partner in that, and how we offer them some financial well-being, and education and access to the things that we have through the partnership. Very appreciative.
Well, y'all are helping the community be physically well and mentally well, and we're wanting to help employees, but also the community be financially well.
That's right.
So it's a great partnership.
It is.
Yes, we're very grateful for our partnership with you guys.
Yes, we are as well.
Of course, now that we're talking about finances, this is a financial podcast. So we did want to ask, what was the best financial advice you've ever been given?
So I laugh when people talk about Dave Ramsey, because I feel like I was raised by Dave Ramsey a little bit. My dad, was definitely one who taught us. He taught us about living within your means, right? And then when you want something, it's working hard to pay for that. I think that's where a lot of my work ethic came from, is just seeing how hard my parents worked to save up for things that we wanted, they wanted for us, working hard to do that and living within your means. And just because you want it doesn't mean you can just immediately get it. That instant gratification, right, is not always the smart financial decision. So I'm very proud to say that he was a wonderful counselor on that financial side. And I also had the inside of a pharmacist when I was working in the surgical ICU who was all about retirement. And he, if there was downtime or something, I remember him just really educating all of us as we were hanging around, waiting on something. And we talked about retirement, and he talked about how he was planning for retirement. And I was probably 23, 24 at the time, but it hit me. It's like, I need to start planning now. Yeah. And if I start planning now, he was talking about how that money would just grow, and it struck a nerve with me. And I started making sure that I was optimizing what West Tennessee Healthcare was offering. Don't leave money on the table. If they're matching a 403B, put that in there, right? And so he was very instrumental on the retirement side of just a casual conversation with a group of nurses and our clinical folks hanging around and talking about stuff. So very grateful.
Yeah, that's
great
important.
Advice.
It was great advice.
Yeah, it's important to just have those people behind your back just to motivate you and encourage you to take those financial decisions. It's good. And so since this is the Pocket Change podcast, we always ask our guests, if you had any extra change in your pocket or pocket change, what would you spend it on?
Oh, I think I would give it away. I don't know. I think I'd donate it. I just have that heart for charity and things like that. We've got a lot of things that we do. I would probably give it to our Hope and Healing Foundation within the healthcare system. We're really focused on trying to do some things with a hospice house and our employee fund. So I mentioned earlier where we want to take care of each other so that we can take care of all the patients. Well, that's one of the things we do. We try to take care of our employees when they hit these hard times, and maybe a house burns or something happens within their family. That employee fund comes through for our employees, and making sure that I'd probably give it to that.
I think that's a great idea. Well, we thank you so much, Tina, for being with us today.
Yeah, you're welcome. I'm very honored to be here today and get to talk about the healthcare system. One of my favorite things to talk about.
Thanks for tuning in to the Pocket Change podcast.
Be sure to rate, review, and subscribe, and check out our full episodes on YouTube.
The Pocket Change podcast was brought to you by Leaders Credit Union,
where we power your passion and make lives better. Cha-ching!
Leaders is federally insured by the NCUA Equal Housing Lender.
Learn more at leaderscu.com.